Good evening. It is an honor to welcome you all to the White House for this important town hall on healthcare. Tonight, we will gather to discuss an issue that affects each and every one of us, the health and well being of every one of us, of our families, friends, and communities. Healthcare is a fundamental right, not a privilege. Everyone deserves access to quality medical care, regardless of their income, where they live, or their background. Yet, we know that our healthcare system faces significant challenges. Many Americans struggle with the high cost of medical treatments, prescription drugs, and insurance premiums. Too often, families are forced to make tough choices between paying for healthcare and other essential needs. Our goal is clear: to build a healthcare system that is accessible, affordable, and high quality for all. We have made strides in expanding coverage and lowering cost, but there is still much work to be done. First, we must continue to protect and strengthen Medicare and Medicaid. These programs are lifelines for millions of our seniors in low income families. We will work to ensure they remain robust and reliable. By preserving these programs, we honor our commitment to those who have contributed to our nation throughout their lives and those who need our support the most. Second, we must tackle the rising cost of prescription drugs. No one should have to choose between buying their medication and paying their rent. We are committed to holding pharmaceutical companies accountable and negotiating better prices for the American people. This includes following, allowing Medicare to negotiate drug prices, increasing transparency in pricing, and promoting the use of generic medications. Third, we need to support our healthcare workers, the doctors, the nurses, and staff who are the backbone of our healthcare system. They deserve fair wages, safe working conditions, and the resources they need to provide the best care possible. We must also address the shortage of healthcare professionals, especially in rural and underserved areas, by investing in education and training programs. Fourth, we must invest in preventive care and mental health services. By focusing on wellness and early intervention, we can improve health outcomes and reduce the burden on our healthcare system. This means expanding access to routine screenings, vaccinations, and mental health care, as well as addressing social determinants of health like housing, nutrition, and education. Additionally, we are committed to expanding healthcare access through the Affordable Health Care Act. We will continue to build on this foundation by expanding Medicaid in states that may have not done so, and by creating new options for affordable coverage. This includes exploring a public option that provides competitive alternative to private insurance, ensuring that everyone has a choice, that no one is left behind. We must also address health disparities that affect communities of color, low income families, and other marginalized groups. This involves improving access to care, addressing implicit bias in healthcare, and ensuring that all communities have the resources they need to thrive. Uh, Equity in healthcare is not just equality in healthcare is not just an imperative, but also an essential for the overall health and prosperity of our nation. Furthermore, we must embrace innovation and technology to improve healthcare delivery, telemedicine, electronic health records, and advanced medical research. They had the potential to revolutionize how we prevent, diagnose, and treat illnesses. We will support initiatives that harness these technologies while safeguarding patient privacy and data security. Lastly, we recognize that health is a global issue. Promoting global health, security, and collaboration is vital to protecting our nation and the world from future pandemics and health crises. We will work with international partners to strengthen global health systems, enhance disease surveillance, and ensure rapid and equitable distribution of vaccines and treatments. Tonight, I want to hear from you, your experiences, your challenges, and your ideals. They're invaluable as we work together to create a healthier America. Our strength as a nation comes from our ability to listen to one another and find common ground. And it really is. You've heard me say this time and time again. There is nothing that this nation cannot do if we come together as one and stop arguing and stop fighting and stop yelling and stop screaming. There is nothing that we can't accomplish. Nothing at all. And I just talked about the healthcare workers. Remember just about 4 years ago, we were all out saluting the hard work of the healthcare workers who kept us safe in the worst of times in this country. A mass pandemic was happening not only in our country but throughout the world. There were flyovers by military flight squadrons, tipping of wings over hospitals, and then all of a sudden they were the bad ones in this. What went wrong? What went wrong? We need to get back to where we salute the healthcare workers. We give them equal pay. We give them the respect I believe they've earned in their hard work. I thank you for being here and for your commitment to this vital issue. Together, we can make a difference and ensure that every American has the opportunity to live a healthy and fulfilling life. Thank you, and God bless you all. Now, there were some questions that were submitted, and I'm going to read the questions and also give you the answer, okay? It's kind of a different way we do question and answer, but I believe this will work this evening, so just bear with me on this, okay? Okay. What specific measures are you planning to implement to lower prescription drug cost? And that's a very good question, actually. I often think about a friend of mine back in Texas, and she had an illness and she had medication. It's not that she wanted the medication, is that she needed the medication. But here's the bad thing. That medication cost $700. $700. How is that right? When Big Pharma is raking in over billions in profits, how is that right? How is that right? So there was this commercial, and I actually haven't seen this commercial lately, but there was a commercial that, and I won't tell you the name of the drug, but this guy comes on and tells you and shows a prescription from a drugstore that this particular drug costs over $400. But through a generic plan, he paid close to $40 for the same medicine. Why are we paying, in this case, why are we paying hundreds of dollars when we should just be paying $40 in cost? And you got these pharmaceutical companies reaping in billions of dollars in profits. How is that right? And what I said was this, we're going to allow Medicare to negotiate drug prices directly with the pharmaceutical companies. This will help lower costs for seniors. Additionally, And we will increase transparency in drug pricing to prevent excessive markups, excuse me, and promote the use of generic medications, which are typically much more affordable than the brand names. And they really are. There's no difference in them. We're just, in reality, most of the time you're paying for the brand. It's like clothing. It's all the same clothes sometimes. You're paying for the name. You're paying for the name. So I want affordable health care. I want affordable prescription drugs for everyone. In this friend's case back home in Texas, you know about my love of educators. I'm married to one, so definitely it's there. Um, they don't make a lot of money, and we're working on that as well. But it took a good bit of her income just to have medicine that she needed. How fair is that? How fair is that? You know, and the second question that was submitted is, how do you intend to address the shortage of healthcare professionals, especially in rural areas? Again, like I said, we will invest in education and training programs to encourage more people to enter the healthcare profession. This includes providing scholarships and loan forgiveness programs for those who commit to working in underserved areas. We will also support initiatives that make it easier for healthcare professionals to move and work in different states. And if that involves making the licensing requirements a little bit differently, I know in the education world there is a nationwide certification. It's tough to get, but once you get it, you can move from place to place. Let's make that available in the healthcare world, where you can go from place to place and and um, and practice your medicine, and especially go to those underserved areas. I won't ever forget this, but there is a place in southeastern Tennessee that was the town essentially came about because of the coal industry. Well, after the town mined the area, they up and left the citizens, left the town there. And one of my good friends is a pastor in in Tennessee, and one of the mission trips he does every year is to go to this town to deliver Christmas presents for those who were kind of left behind. And it makes you think, what if we had the means to have doctors and nurses available in those towns? They deserve health care. Just because they live in an underserved area doesn't mean they're not able and shouldn't be able to have the health care they need. So we're going to work on that under my administration. We're going to work on that, and we're going to see what we can do to get the health care that every American in every state needs. And the next question is, what steps are being taken to ensure that mental health services are accessible to everyone? And I think that mental health is the key to solving a lot of our nation's problems. I truly believe it is. The rise in crime. Just 4 years ago, think about when we were in lockdown. The pandemic was in full force. It was hard to be shut up in your homes for days and weeks at a time. And people were starting to snap. I mean, that may be a little rough term to use, but people were starting to break down. I firmly believe that if we had the resources available that they could call upon to get help, some of the things that happened during that first summer of the pandemic would never have occurred. In my administration, we are committed to integrating mental health services into primary care settings to make it easier for people to access across the nation to access the care they need. We will increase funding for mental health programs, expand telehealth services, and work to reduce the stigma associated with seeking mental health care. And we will. That's part of the problem. One, it's access. Secondly, it's the embarrassment of seeking out mental health. Mental health. Why should you be shamed for trying to help yourself? Why should that happen? And so we're going to do what we can. I know I've said a lot of this. We're going to do what we can, but we are. My friends, I truly, truly believe in what I'm talking about here tonight. And I know that if we do these things, our country can be much better. And we're also going to ensure that insurance plans cover mental health services. And just like they do with physical health services, oftentimes insurance companies will not cover mental health services and needs. You should be able, if you have a problem that you can't handle that you talk to your family and loved ones, and you need or you don't have immediate family, and you need additional help, you should have that access available. You should have it available. The next question is, how will your administration tackle health disparities among different communities? And I mentioned that just a few minutes ago. We will focus on improving access to care for marginalized communities by expanding Medicaid, increasing funding for community health centers, and addressing social determinants of health, such as housing and education. We will also implement training programs to reduce implicit bias in healthcare and ensure that all patients receive equal treatment. And really, it is. It comes down to every person. We live in the United States of America, and I believe it's every person's right to have health care and affordable health care. It shouldn't be a privilege for those who can afford it. Just like I mentioned about the prescription drugs. It wasn't that she wanted this medication, it was that she needed it. And how is that right? To charge that enormous fee, that price. Why is that right? When they're making in billions in profits. We're going to work on that. We really are. And I know this has been tried several times by several different administrations, but we're going to do the very best we can to give every person in this country the health care that they deserve. And the next question was, can you elaborate on your plans to enhance global health security? Well, I think a lot of that has to do with the relations we have with other countries. We will work closely with international partners to strengthen global health systems and improve disease surveillance. This includes investing in research, development for vaccines and treatments, ensuring rapid and equal distribution of medical resources, and supporting efforts to prevent and respond to future pandemics. The collaboration and information sharing will be key components of our health strategy. And that's one of the things that you think about one of the predecessors. One of the things that he continues to work on, and I'll go ahead and say his name is President George W. Bush. What he continues to work on is during this administration, he issued an executive order for emergency relief for AIDS relief. And this came about because of his National Security Advisor / Secretary of State, Condoleezza Rice, who came to him one morning in the Oval Office and said, Mr. President, we need to do something or we're going to lose a generation of people in this world. And so that is one thing that his center has continued in his post-presidency. And so they're working hard. The problem with these programs is this. These ideals are all great. But without funding, they're worth what they're printed on paper. They're worth what they're printed on paper. So we've got to get funding for these things. But I think as far as world um, health, I think building the relationships of other countries, and we all have an equal uh, uh, stake in this. We really do, an equal stake. It's not just we should do whatever we can to help, especially the emerging democracies in our world, especially every country, honestly. If there's a pandemic out there or some dangerous disease out there, we should come together as one and eradicate it. We should do what we can to make this world a much better place, not just for the established democracies, the up and coming democracies, but for everyone. The next question was, what role does technology play in your vision of the future of healthcare? Well, technology, it will play a crucial role in transforming healthcare. We will promote the use of telemedicine to increase access to care, especially in rural and underserved areas, like I've talked about, and will support the development and deployment of electronic health records to improve care, coordination, and patient outcomes. Additionally, we will invest in medical research and innovation to advance treatments and cures for various diseases, all while ensuring that patient privacy and data security are protected. And I, I know that the school district that Andrea works with, one of the benefits they have is telemedicine. And it's a great service. You call up and you get a doctor on the line. You tell them your what your what your problem is. I mean, what your ailments are, and they will prescribe a treatment for you. And oftentimes, this is needed when you can't get into a doctor for weeks at a time. And so, having telemedicine, have these underserved communities being able to have a telemedicine, I think, is incredible. And so, having access to, I think, is incredible. And so, I believe, again, like I said, a lot of these things that we're talking about are ideals on paper. And I know it's been tried. It's been tried before, but well, like I said at the onset, I don't think, and I believe that we can, as a country, accomplish anything we want to. We set our mind to it. If we set our mind to it, healthcare, the cost of healthcare, it's going to continue to rise if we don't do something about it. Healthcare disparities are going to continue to rise if we don't do anything about it. It's time for us to act. And we've got a great plan. Now it's time for us to put it in action. I thank you very much for your time this evening. I don't get a chance to do these town halls a whole lot, but it's an honor and a privilege to do this. And we will do this again. This will definitely be happening again. Maybe not on healthcare, maybe on another topic. And I want you to remember this too. We're not just going to have this discussion here tonight and move on to the next item and forget about this. We're going to continue to work on this until every American has affordable health care and everything in prescriptions, telemedicine. We will continue working on that. When everybody in this country has access to that, our mission is complete, but not a day until. Thank you very much. May God bless you, and may God bless the United States of America. Thank you, thank you, thank you.